So here we are with part 2 of the Quarantine Diaries. This time the focus is on the US, where not only do we have a global pandemic raging before us and all the world, but we also have some local and national issues. So you'll hear stories from people I've met along the way, from undergrad to graduate school, all the way back to preschool. So people I've known for almost 25 years.
That being said, let's first visit Megan, one of my childhood friends who works in New York City.
And I am the Associate Manager of Digital Content and Sales at Kensington Publishing, in the epicenter of the coronavirus. We have more cases than Brazil, which is the country with the second highest number of cases. Our state alone. Yeah, at this point, it's actually great because there's been a lot, the testing has increased so much, but new positives are going down, so they're catching a lot more of it. So I'm happy about that.
Traveling south to Florida, we meet yet another dear childhood friend of mine, Erin.
Sorry, Dr. Meldrum.
Doctor, I paid for that doctor.
Yeah, I know.
Just passing the time studying here. I'm in Rockledge. I'm not working right now just because everything's shut down. There are no openings or anything at the moment. So I took it as a time to really focus on studying for boards since I graduated with my doctor of physical therapy.
Yay!
That's about it. That's all I got.
Let's go to the West Coast now to meet Julie, my soul sister in San Francisco.
So I'm Julie Fornaciari. I'm a graduate student at University of California at Berkeley and also at Lawrence Berkeley National Lab. And what I specifically am studying is energy conversion devices. So I'm looking at electrolyzers and chemical feedstocks and how we can oxidize those electrochemically. So COVID has been an interesting time for that.
And last but not least, we travel back down south to Houston to meet my former roommate, Alyssa.
How are you doing?
I'm good. This week was a lot. You've seen the news, probably. Even on NPR, they were like, this is a lot for us. And I'm like, yeah, okay. So yeah, we're getting through. My name's Alyssa. I'm studying bioengineering at Rice, working on global health. Pretty much everything in our lab has a connection to low-cost medical devices somehow, but my lab has kind of two focuses. One is imaging for cancer detection, and the other is point-of-care diagnostic for diseases, which is pretty relevant right now, actually. There's a lot of my lab mates working on a point-of-care COVID-19 diagnostic. We all felt like we had the expertise to tackle this problem, but also to tackle this problem specifically for low-resource settings. So our expertise is in making devices that you don't have to rely on expert technicians and electricity, fancy medical equipment. You can do things on paper, portable, right at the point of care. And we feel like there's the issue of once these technologies are developed, can we make sure they reach the right people? And so if we can do that from the design phase, then that will make it much easier to use in places where there's not reliable healthcare resources.
So I'm actually, I think, very fortunate in these circumstances. I started computational modeling with a numerical solver called ComSol. Most of the time has been 50-50, modeling and experimental. So now I've kind of shifted all to modeling, where a lot of my work has been kind of uninterrupted. The beginning of COVID, I was writing through a paper, and that paper is kind of getting worked on by my collaborators. So for the most part, research-wise, I'm still pretty much working a typical, maybe not as much of a crazy work day as some grad students can get, but I have definitely shifted all the way to doing only modeling support.
Yeah, I know for me, there aren't a bunch of people around me working, and this is where I relax. So of course I'm gonna relax while I'm here. Whereas if I was at school or something and everybody else around me is studying, then I feel okay, that's what I'm supposed to do right now. I set up a camping chair, that the type that fold out, and that's now my alternative study area, just so that I can sit up completely straight and there's no chance of me falling asleep while I'm studying.
University of Florida required you to work from home starting when?
It was the second week of March, which actually worked out really well for me because I've been in clinicals for the past year. And they're like 2 months at a time. And I finished my last one the first week of March when they decided to turn everything online. So I got out of there basically just in time for when they made the transition. And just as like a safety precaution, you don't need more people in the hospital than what's necessary. So they sent all the students home. But for me, it was just, I had 2 months of classes that I just had to finish up. And so thankfully I was able to do all of them online.
So you actually got it perfect timing then.
Yeah, it was very close.
I mean, also after this whole period is over, we're going to need a lot of therapists doing, like, think of all the sedentary lifestyles.
I know, just looking at all the people who are celebrating going back to the gym and I can't wait to work out, and just thinking all these people haven't worked out in like 2 months and they're all going to go straight back into it. And so people are bound to get hurt. And
you're bound to be employed.
Now's my time.
Yeah, so the last day I was in the office was March 13th. That's when they were like, yeah, we're still going to be coming in off and on, Sometime in mid-March and late March, I believe, they shut down the state and said, if you're not essential, you can't go in. To some degree, it's kind of nice because I don't have to get up as early, but I've had a bit of an issue concentrating, so it's a lot of like, I'm on Tumblr for really long periods of the time during the day, and then I'm like working until like 11 o'clock at night because that's when I can concentrate for some reason. Part of it is frustrating because for me specifically, I handle all the ebook stuff. And because people can't go into physical stores, they're kind of banking on ebooks to save everything. And as far as I've seen, like, we haven't had some kind of huge increase in sales. I do know in terms of just book publishing in general, my roommate works for HarperCollins in like the children's division. She mostly works in middle grade, and they've actually had like a big increase in like children's specific sales. Probably because like a lot of parents are buying stuff for their kids to keep them entertained right now. I don't know that we've had any kind of increase on that end on the adult side. Basically, they kind of want to optimize that and metadata on everything, which makes sense. It's just been a little frustrating because it's a lot of do everything you're already doing, and then also optimize all the keywords and the cover copy thing. They also decided they wanted the ebooks to be finished earlier because we can't do physical mailings anymore. We had to get another girl on the team to start helping with this, and basically production now has to send final files and ARC files, which will do like galley copies of a book before it goes on general sale, to like get bloggers and to like different places that give review, like Publishers Weekly and stuff, Kirkus Reviews. So basically we're using those files to make early editions of the ebooks that are going to have more like grammatical errors and just typos and stuff to get them out to people as soon as possible, just so they can have like some kind of advanced copy. We're getting somewhere. I mean, I think because my position is so technologically based and based so much on the digital side, it's just been a lot of like, that's the only thing we can do now.
For instance, in California, it started around March 16th. So I was in lab Monday, and then by the afternoon, they were like, we're shutting down and you are not coming back until further notice. I think the biggest thing that I miss a lot is I just miss my lab environment. It makes it a lot harder to go to work when my bed is literally right here. And I don't have my lab mates to have coffee with or ask questions. And so we've been trying to fake that through Zooms, but it's not 100% the same. And I think that's made me slightly less like excited to always go to work when I don't have the people to like motivate me. And so it took me a while to really like get into a groove of, okay, like have 30 minutes to listen to a podcast, eat my breakfast, have my coffee, and then get to work, to really think like, okay, my desk is my work desk and like I have to do it.
Since all of this global pandemic has caused panic around the world, how does that make you feel about what you study? Like, has that changed how you look at global health?
I think like you can spend a long time getting a specialized set of skills, and it's just hard to know what'll be relevant at a certain time. But I mean, it's global health. It's like, that's one that I feel like right now is, you know, just as relevant as it was.
And now I hear rumors of reopening. What does that kind of look like for your area?
Right. Texas was one of the first places to reopen. My lab opened this past week, actually. our capacity is based on square footage. So our lab's allowed 7 people at once because we're a fairly big lab. Not all of them need to be in the lab all the time. Some of them are doing computational work, writing and stuff.
I guess what's the mood in locally, like at the university as well as in your state?
Gosh, I think that depends who you ask, to be honest. It was about a few weeks ago that we started to see like restaurants have people in them, and traffic's gotten a lot worse. I feel like I can't say for all of Texas. Like, it would depend if you have medical conditions that you're worried about or whether you're worried more about making an income. And I can just say, I mean, for me, I feel like it's too soon, and I get really nervous seeing people in restaurants and feeling like that's just not very smart. Yeah, and I'm kind of just frustrated with Texas and Georgia and other similar places where the governors seem to be more invested in opening up businesses to but also just manipulating data to make it look like cases are going down. So it's hard though. Struggling for money and you're trying to feed your family, then I don't blame people for doing whatever it takes to make that happen. But I mean, that's what government is for, is to try and put in place rules when people have incentives to otherwise not be mindful of others.
I think even we have no plans to go into the office yet, but even when we do, it's supposed to be like not everyone's in on all the same days. It's still going to be like a partially work from home, partially come in, I mean, like there was one person in my office who had COVID, so concentration in New York is pretty crazy. We found this out in like mid-March. So at that point, it's like, unless you're going around like licking bars or something, it's not your fault. It's a lot of assumptions based on like past knowledge of viruses that is not necessarily going to like work the same with this one. We don't know.
But Lawrence Berkeley National Lab is doing a pilot program, so they're slowly bringing more and more people in to make sure they kind of get through the kinks of adding more people in. What does social distancing look like in small constrained areas and small offices? June 1st was their first day back in lab, but that's only about 350 people back on lab in addition to the essential workers. So there might be around 1,000 at most that are on site, but we're actually around a 5,000 person lab. For reference, our lab is around 26 people, and only 6 people get to go into lab on this first rotation, and only 4 people per day. So it's a rotation program and we're all learning. July, they'll probably double that amount. But because my group is about half modeling, half not, the people who are doing all strictly simulations or like PIs, we actually have like a timeline of mid to end of September is when you might be able to get back into lab. University, they're opening up in about a week, hopefully. And they're also having strict social distancing within the UC system and having to submit plans to the county to assure that they're abiding by all of the rules. UC Berkeley, at least, is planning, or at least our department is planning to have all virtual classes to assure that they can kind of accommodate all students, no matter if they're like, say, a high risk or say they're a non-traditional student. I think they're leaning much more towards all virtual. So I have a feeling I might go back in the lab and then I'm going to be like, well, I got to teach now. So maybe I'll be back in the lab, or maybe I'll be teaching a lot more, so I won't be able to. Who knows? In general, the Bay Area is being really conservative. Restaurants are being open for more social distance dining. But for the most part, everything has still been shut down. It's kind of wild to be on social media, for instance, and just see people who are like out and about back into the normal life almost. And I'm just like, where's your mask? Like, I don't understand. Like, why aren't you social distance with people? This doesn't make sense. And at least for Berkeley and the lab, if we get a case, we get shut down again.
A lot of places originally opened up like the restaurants or hair salons. They've been opening up greater capacity in the restaurants, still with like the 6 feet apart rule. Gyms that just recently opened. And I think some theme parks even opened too.
Like, is everyone rushing at once to go to all these places, or you still think it's a little like cautious?
I think there's a mix. Like you see on the news, like everybody's flocking to the beaches. I went to a restaurant for like the first time in 2 months, and it was fairly empty, even though the news would make it seem like, oh, everybody's going out to the bars and going out to eat. But it's not, from what I've seen, at least in this area, it's still fairly empty everywhere you go, but there are some people who are very much so like it's too soon and, still stay at home if you can, don't go out, which I'd kind of like, I'd probably fall into that train. Like if you can stay home and work, like stay home. But if you do, like if you can't work from home, then okay, let's try and get that back and start it again. Whereas you have like the opposite end of the spectrum of people who are saying like, we should have never closed in the first place and we need to live life normally.
With all this going on, like how are you trying to stay healthy physically and mentally during these times?
Especially with also the civil rights movement.
I was a little behind. I kind of went into my research bubble and then I got out of it and I was like, oh, yep, this is all happening. And I'm trying to catch up on a couple of things, to be quite honest. I think the STEM shutdown today is a great opportunity and has been a great opportunity within my labs and other labs to start this conversation about what does anti-racism look like, especially in academia, and how do we start talking about it. And I think that's actually just puts a lot of energy of how can we foster this community without being offensive or being insensitive. We're doing the bare minimum, which is still, we have a long way to go to make action items and make change and start seeing it. But starting within the lab group and having discussions with PIs and with postdocs. I participated in a Black Lives Matter solidarity ride, so a bike ride. Such a great experience. There were thousands of people there, and the spirit there was amazing, but it was just so strange to be around that many people after not being around that many people for such a long time. And there was like a lot of power with that, of knowing you were isolated for so long and then you come together for a very specific reason and still feel like you're social distance because you're on a bike. Like, can't really get that close. So
New York has more cases of coronavirus than any other, but at this point, we're at a point where daily new cases are low enough. I didn't feel like I was at super big risk of getting sick for going out. I was more scared of the police, and I probably would not have gone out if Nicole had not messaged me about it. So I went with Nicole. The first one was a march, and the second one was a drum circle at Grand Army Plaza, which is a little north of Prospect Park. But yeah, that one, there was less chants and stuff because we were mostly listening to the drumming. And then there was a man who would talk every once in a while. I mostly just noticed there was this NYPD helicopter just circling the entire time. So they were clearly monitoring the situation. They were clearly there was a presence there, but they weren't physically walking amongst protesters. So it was pretty much everyone that was walking was just someone who agreed with the cause. So it was this peaceful walk.
It's going to be a sort of an unforgettable time, and you're going to look back on this and think, where was I during the coronavirus 2020? Are you going to look back and be like, okay, I think I did what I could? Or are you going to look back and say, I really should have taken advantage of time I had?
But that's a hard one too, because I feel like there's also people feeling under pressure, like they have to be productive at the moment. So I guess to each his own, but I felt kind of working on other just personal goals, trying to read more. I've been in a public speaking club, and it's all virtual now, but it's something that I was doing now that I wasn't doing before coronavirus. You can take small measurable steps towards your progress.
I try and set a goal every day to at least get outside at some point or move around and do something, just so I'm not sitting and watching TV the whole day or sitting and studying the whole day. Lately I've been trying to limit how much I'm on Facebook or checking the news, just because of how, what we were talking about, people are so polarized and so negative about everything that, job market's at an all-time low and employment's all-time high and I need a job. That's never great to see as a new grad.
In a positive social media vein and on a no one wrote the book on it vein, there is a thing, because I follow a lot more publishing related stuff, but they're doing a Black publishing power thing where they're trying to have people buy books that are Black authored to try and have more Black authors on the New York Times bestseller list. So I'm looking at newer releases, and I'm probably gonna buy a couple books. I'm trying to not buy stuff lately, but I'm gonna buy a couple books maybe. I'm gonna go on bookshop.org, and there is the Lit Bar, is this Bronx bookstore owned by a Black woman, and you can like support them through buckshop.org.
How I'm dealing with my mental health has just been reading a lot, which kind of helps in regards of also reading a lot on like anti-racism, and actually just being much more stringent on my time of I work from 8 a.m. to like 5 or 6 and like I'm done, and been watching more TV and reading and doing a lot more yoga. Social distance picnics are becoming more and more like of a real thing. So I think that has helped just kind of fitting in things that are a little bit more normal and plugging in with people who share similar thoughts, share different thoughts, and participating in conversations, I think has been the most helpful.
Every once in a while, I just put on some like either country or kind of like late 90s, early aughts music and dance around a lot because I need that. So I've been trying to write in like my diary a bit more because that makes me center myself a bit. Or I've been listening to the podcast Staying In with Kumail Nanjiani and Emily V. Gordon, and I've been enjoying that.
I guess maybe one thing I'd add is like keep making memories with people, if that makes sense. Like even now is a good opportunity to make new memories. Like for us, we have movie nights that, you know, we could have done this before with Dan, but we just never thought of it. And Dan lives in Tokyo. And now it's like, well, this was really easy. I've been doing baking nights with friends, and that's been awesome. That's with Mark in Australia. I've been doing the core power yoga videos with Caitlin, and so that's a new memory for us. And just like this can be a time to be like, you remember that time during coronavirus when we did this? That helps more than your just catch up phone calls.
Like harnessing those connections with people that you would ordinarily have to travel across country to and remember to reach out. Finding those people that you really do trust and start those conversations. Remember that you're not alone in it, even if it feels very alone. And we're lucky because if this was back for like, say, the 1918 flu, we would be a lot more isolated and a lot more alone. So remember also to like not look at your computer for a day. That's also good.
If I were to give some advice, I'd probably give the same advice that I would give if there was no pandemic going on. But just in general, try and keep things in perspective and like think of this in just like the grand scheme of things. Things may be rough right now, and granted it may take a while to return to normal, or normal might be slightly different than it was before, but 20 years from now, will the past 6 months really make a huge difference in the course of your life? Probably not, unless something major has happened during this time. But for most people, it's just going to be a blip in their lifetime.
So speaking of normal, what are you going to do as soon as everything's back up and assuming you're able to be out and about?
Yes, I'm definitely planning on going down to Florida in like maybe August or September. Like I really want to wait till I feel like there's less risk to traveling. My cousin's having a baby and my stepbrother's getting married.
But it's funny, I've seen people from afar and I'm like, I've never realized how much I miss giving you a hug. Like, weird. The hugs, I don't know when that'll come, or like when I get to go home and see my niece and future nephew when he is born. I'm not that much of a huggy person, but just like when you don't have it, it makes for such a big difference.
What would I do for fun? I don't know. I'm a pretty boring person. I like staying home. Is that an option? I'm able to go back outside. I think I'll stay here.